Now, what is the philosophical background of the Boenninghausen therapeutic pocketbook? As we know, Boenninghausen is a student of and a friend of the Hahnemann. He is a follower of the Hahnemann. So he adapted or he accepted the following fundamental as pronounced by the Hahnemann. Number one, nothing can be known of a disease except through the sign and symptoms. So what is about this mean? It is meaning that a person who is sick, he will tell you that sign and symptoms, and only through the sign and symptoms we can get the actual picture of the disease of a person. Okay, so if the patient is sick, it is the whole person is sick, not his any part of the organ is sick. It is the whole patient or the whole person is sick, and symptoms are only the unfailing guide to the selection of the remedies. So for this we need a homeopathic totality. Okay, for this we need homeopathic totality. The Boenninghausen just make it easy because he has seen that while taking the sign and symptoms, he does not get all the symptoms from each and every patient. Okay, for example, a person is suffering from headache. Might be he is giving you the location, but he is not giving you the actual modalities. Okay, sometimes he feel that these are the obstruction to take the whole case. Now, in philosophical background of Boenninghausen therapeutic pocket repertory, he stated that the first is your the location. In the totality of the symptom, the first is the location. Which part of or the which part of the body is affected, which organ is affected, which tissue is involved, everything. So this is your location. Now the second is the sensation. Sensation means the kind of the pain or some organic or some suppose a stitching pain or the pinching pain. What are the sensation? Sensation as if something is around my head. Okay, something some cloud is around my head. Sensation as if I am severe headache, as if someone is pulling from behind. Okay, some patient will tell you like that, I have severe pain in my knee joint and I'm not able to move the knee joint and feel that someone is pulling my joint. Okay, so these are the sensation, either it is type of pulling sensation or some blowing in the head, hammering sensation. Okay, so this is now this third one is your condition of aggravation and the aggravation. So this amelioration, so this is an aggravation sign and this is an amelioration sign. The circumstances which increases the problem or decreases the problem. Whenever I have headache, I am not able to bear the any light. Even the light of even the tube light, even the light of a bulb is not. I can't tolerate it. The sun heat aggravate my problem. So what I do, I cover my face. I want to sleep. I want to sleep by making my room dark. Okay. So what does this mean? Darkness, amelioration, and sun heat or the light aggravation. During headache, I am not able to tolerate any type of the odor. Okay, any type of the smell. It increases my headache. So what is this? The odor, the smell, aggravation. So these are the what are the aggravation factor or the exciting factors and the ameliorating factors in which the patient get relief. So location, sensation, and the modalities. The fourth one, which is very important one, this is your concomitant. It is very important. Concomitant means accompanying symptoms. Okay, what does it mean? It means your accompanying symptoms, or according to the Boenninghausen, it is your peculiar, rare, queer, and the rare symptoms. It is in characteristic symptoms. It is in secondary symptoms. So according to the Boenninghausen, concomitants means like accompanying symptoms. It is in peculiar symptoms. It is in secondary symptoms. Concomitant symptoms, which is in some symptoms which we cannot give you any reason why it is present within the patient. For example, whenever I had a severe headache, my hunger increases. I want to eat. Okay, I want to eat. I want to eat. So hunger increases. Whenever I have headache, I don't know, but I have to go for the pee every time. So urination increases. So there is no particular relationship with the headache and the urinary bladder. Okay. So this is known as your concomitant symptoms or the accompanying symptoms. So these are the unreservable attendant symptoms. So what we see according to the symptoms, according to the Boenninghausen, what we need to get from any patient, we need to get the location, sensation, modality, and the concomitant. And above this four, the concomitant is the most important. Okay, that is in PQRS, peculiar curative rare symptoms, which has been detailed in the aphorism number 153 of Organon of Medicines. Okay, so this is all about your philosophical background. So one is your doctrine of concomitant is important, and other is a doctrine of analogy. So what do you mean by the doctor? So Boenninghausen himself, he recognized that even after the best possible case taking, the case taking is always incomplete or in a fragment. Okay, for example, in some you will get the location but you won't get the modalities. Okay, in some cases you get the location but you do not get the sensation. Okay, so these are the things. It is always, you won't find the complete symptoms in everywhere in some patient because of the lack of observation. So what the doctor Boenninghausen said that whenever, suppose a patient cannot describe the aggravation or amelioration of a particular symptom. For example, a patient is suffering from headache and he cannot describe the aggravation and the amelioration symptoms. But the same patient is suffering from the lower back pain, and in this case, he can tell his aggravation and the amelioration. So we can use this aggravation and amelioration in case of this headache. So what does that mean? What is true to the part is it true to the whole? So that the same thing you in the sensation. For example, in one part the patient is telling that I have an headache, it has a pulling sensation, and in the back pain he doesn't say he is not able to tell you the sensation. So you can add the sensation in the back part or in the lower back symptoms also. So this is known as your doctrine of analogy, that is what is true of the part is true to the whole. Whenever in the next part, when I teach you about the how to take the case in Boenninghausen therapeutic pocketbook with example, it will be easy for you. Okay. So this is all about your plan of construction. So what is the philosophical background? The philosophical background is that Boenninghausen is a like student and a follower of Hahnemann. So he follows the Hahnemann way of prescriptions. So what are the Hahnemann way? That is, nothing can be known of a disease except its sign and symptoms. If the patient is sick, it is a whole the person is sick, not his part of the any part or the organ is sick, and the symptoms are the only unfailing guide for the selection of this medicines. Okay. Now according to the Hahnemann, he described the symptoms in two forms. One is a general symptoms. So general symptoms are the common symptoms such as fever, body ache, okay, so headache. These are the common symptoms. And about the uncommon, peculiar, and the rare symptoms. Okay, this about the Hahnemann. And about the Boenninghausen, he describes the symptoms in a two way. One is the primary symptoms. In the primary symptoms is the location, sensation, modalities in concomitant. So, for example, if the person is suffering from the headache, we need to take this location, his type of the pain, his modalities, aggravation, and the amelioration. Okay, and the secondary symptoms, an important one, which is known as your concomitant symptoms. Now, this concomitant symptoms is basically the symptoms and that is peculiar symptoms or like accompanying symptoms with that of the common symptoms. Okay, sometimes in concomitant symptoms also you will get the location, sensation, and this modality, and this symptoms is very much important. Okay, so in philosophical background, that is doctrine of concomitant and doctrine of analogy, that is what is two to the part is two to the whole. Okay.